Hello, my name is Alejandra ESPARZA, an internal medicine resident in Monterrey, Mexico, and I'm going to be presenting the work called Clinical Presentation and Time to Diagnosis of Adult-Onset Still's Disease in Northeast Mexico, Early Diagnosis in an Intrahospital Approach. The adult-onset Still's disease is a very rare systemic inflammatory rheumatic disease which is characterized by the presence of fever, arthritis, and rash. Due to the unspecific symptoms and the scarcity of the disease, it is a difficult and delayed diagnosis, which has an impact on patients' quality of life and prognosis. We studied retrospectively patients diagnosed with adult-onset Still's disease in a period of 3 years in a public and private hospital in Mexico, with the objective of analyzing its clinical characteristics and time to diagnosis in our population. 5 patients were included in the study. The most frequent clinical characteristics were fever, arthralgias, and pharyngodynia. The most constant findings at physical examination were rash, lymphadenopathy, and splenomegaly. In laboratory parameters, we found that hyperferritinemia was present in 100% of the patients, with a median of 4,392 as observed in Table 1. Leukocytosis with neutrophilia was present in 80% and abnormal liver function test in 40% of the patients. The median in the time to diagnosis in our group of patients was 20 days, with a range of 10 days to 1 year. 4 of them were diagnosed in less than 30 days and only 1 in 1 year. This is significantly lower than the delay reported in the literature of 4 months. We consider important to mention that the diagnostic approach in the group of patients diagnosed in less than 30 days was done in an intrahospital manner, which may contribute to the reduced time to diagnosis, even though one of the hospitals is a resource-limited setting. Also, both hospitals included are teaching hospitals, where residents are actively involved in the diagnostic approach of the patients and could be a factor that sped up the time in our population. Remarkably, we found that 100% of the patients presented with fever, arthralgias, and hyperferritinemia, whereby these parameters can further be studied as a screening tool in patients presenting with fever of undetermined origin. There are very few studies that describe this disease in the Mexican population. Even when it is an uncommon condition, some clinical data could help in a faster diagnosis, such as the constellation of fever, rash, and arthralgias in a patients where infectious and other rheumatologic diseases have been discharged. Further research in the area may help in developing faster diagnosis protocols in Latin American population with or without resource-limited settings. Thank you so much for your attention.